Hi, everybody. I'm Lisa Twerski, and here with me now is Dr. Nachum Klafter. Dr. Klafter is a psychotherapist, a psychoanalyst, and a psychiatrist in private practice, and he's on the teaching faculty of the University of Cincinnati and the Cincinnati Psychoanalytic Institute. And he does a lot of other things that we won't go into, but he's a prolific writer and speaker and trainer. And I'm really excited that you're doing this one because we're going to be talking about personality disorders. And personality disorders are incredibly complex. Thank you so much for doing this because I think you're going to be an incredible help to us in this incredibly difficult, complex subject matter. And thank you for being here. I really appreciate it.
Nice to see you again, Lisa. Nice to be here.
Thanks. This is going to be part one of what is going to be a two-part webinar on personality disorders. It's, like I said, a very complex subject. And we're going to start out in part one talking very thoroughly about what a diagnosis of personality really means. What are we talking about? What does it look like? And we're going to gain a real understanding of the experience of the person themselves with a personality disorder, what their struggles are, what their difficulties are, and how we can, if we recognize that they're struggling, how we can help them get help. And in part two, we're going to discuss what it's like to be in a relationship with the person who has a personality disorder, whether it's a personal relationship or whether it's the helping relationship, and what that can look like and feel like and be like for the person. So let's start with, what are we even talking about when we use the term in psychology, personality? What do we mean? I think we need to start with what we mean by that so that we can then start to maybe understand what we mean by a disorder in the personality. So if you could start there, that would be great.
Yeah, so personality, actually in psychology or psychiatry, we really mean the same thing when we use the word personality that we do just in using the word in English in general. And we mean the characteristic way that somebody interacts with other people, the way they form relationships, the way they see themselves, the way they react to things emotionally, the way they regulate themselves. We can sort of predict who would laugh at this joke, who wouldn't laugh at this joke, who would like this, who wouldn't like this, who might you get along with, who might you not get along with. And when we do that, we've made assessments, not as a professional, just as sort of like ordinary person, of someone else's personality. So that's what a personality is. And then in psychology or in psychiatry, we've systematized it, but it really means the same thing. We break it down into 4 specific areas of how a person operates. And we say that the things I'm going to talk about now are the way you kind of always behave or usually behave, and that this is kind of settled into the way you normally conduct yourself and feel about yourself and interact with others from the time you were a teenager or a late teen all the way stable through adulthood. Now, personality does change over the lifespan, but we're still talking about a stable kind of thing, as opposed to like when you're in a good mood or in a bad mood, when you're excited, when you're mad, when you're happy, when you're sad. That's a state. But this is more like, you know, what are your traits over a long period of time? So the 4 areas that we talk about with personality, the first area is interpersonal relationships. How do you relate to other people? How do you feel about them? How do they feel about you? How do you engage in relationships with people? As a friend, as a spouse, as a parent, as a sibling, as a student, as a teacher, as an employer, as an employee? What would be their characteristics, ways of engaging with people over time in a regular way? The second area we talk about, the word that's used for it is called cognition, but we don't mean like how good you are at math and how much you remember. We mean, how do you think about yourself as a person? How do you understand other people? When people, if you would say to me, I really need to talk to you, Nachum, do I assume I'm in trouble with you, that you're mad at me? Or do I assume, oh my gosh, I'm so important that you're dying to talk to me? You know, what is my assumptions about things? That's
Mm.
another, we call that cognition. Like, what is the way you typically will interpret things and understand things? A third area is impulse control. When you really need something, when you want something, when you're upset, when you're angry, how do you soothe yourself? How do you regulate yourself? How do you calm yourself down? Or to what degree do you want what you want now and you can't delay your gratification for something? And the fourth area is what we call emotional reactivity. When something happens, like, how do you react to it? How do you react to it? Do you overreact? Do you always stay optimistic? Do you never let yourself get sad? Are you very, very aloof emotionally? You know, what is your emotional reaction to stresses or changes that happen? So if you look at those four areas together, that is a pretty good summary of the person's personality. You can like summarize what someone is like in those four areas. Someone you know well, you could like sort of describe how they are in one paragraph in each one of those areas. And those four paragraphs together, it would be like a pretty good picture of the person.
Right.
Then when you want to know what is a personality disorder, it's basically when people in two or more of those four areas.
Just hit the four again for us.
Right. So the four are interpersonal relationships, cognition, which means ways of interpreting things, ways of thinking about things, impulse control, and emotional reactivity. Those are the four areas.
Right.
So when we talk about a personality disorder, we're describing people who in two or three or four of those areas, but at least two, they characteristically operate very differently than the rest of the population, or than most of the population. And it's also very inflexible. Like, the way they are is sort of always that way, and it's sort of extreme compared to the rest of people. For example, if someone is very, very shy and they're always afraid of being criticized or being scrutinized or being judged, and they don't socialize, they don't meet people, they don't speak up, they don't go out, they don't go in, they're afraid of whatever the reasons are, they're afraid of rejection. So they're so shy that they really, it's different than most of the population. That would be an example of one area where they have something that's widely out of the normal range. And in those two areas or more areas, it causes problems in the way they can function socially, work, be in school, relate to their relatives. So, or it causes them lots of distress. So it's abnormalities in two or more of those areas that causes a lot of distress for the person, or it causes problems with their ability to really function normally.
So that gives us a very sort of clear conceptualization of what we're talking about in terms of personality and in terms of what starts to be our criteria for determining that there is a personality disorder. Do we know what causes a personality disorder? Like, how does it come about that these two or more areas are in disturbance? Are troubled? What in the development or?
Right. So that kind of depends on your theory of personality. I'll give you like the most general one that almost anyone would agree with, which is that we're all born with sort of these innate God-given or nature-given potentials inside of us. Some people are musical, some people are social, some people are mathematical, some people are artistic. We've all got these different capabilities. And then the task of life is how can those capabilities blossom? So some people, we don't only have these capabilities, we also have like weaknesses or vulnerabilities. Some of us are very easily angered. Some of us are very easily overwhelmed and nervous. Some of us crave constant reassurance. Some of us have problems with hunger and our physical appetite. Some of us, all different kinds of things. And those things start off biological. And then at a very young age, we're also socialized to, we're encouraged to develop in certain ways. And so by the time we're, 6, 7, 8, 9, 10 years old, between our biological disposition that we're given from God and from our DNA, and also the way we're raised by our parents and our siblings and our teachers, there tend to be conflicts between what our natural tendencies are and what everyone wants from us. So for some people, just kind of the mix of what their natural given tendencies are and what the expectations were in the environment, there's such a big conflict that parts of the development kind of get like stifled and thwarted. So you have sort of like a form of immaturity or developmental arrest. And then a lot of time in life is spent like trying to protect themselves from pain, anxiety, or trying to soothe themselves with lots of, you know, some people need to have constant reassurance and companionship to reassure themselves they're not lonely, that no one hates them. Whatever the things are, you learn sort of these ways of coping, and that's kind of what forms your personality. So everyone has some weaknesses and vulnerabilities. Everyone has some strengths. And then if the weaknesses and vulnerabilities and difficulties are to such a degree that it forms these problems, we call it a personality disorder. But basically, it develops the same way personality does. You know, it is the person's personality. That's another thing I wanted to point out. We call it a disorder, but it's not a disease like hypertension or bipolar disorder or schizophrenia. It's the person's personality. So it isn't really like, it's not like I caught a case of this personality disorder. Like that's me. That's like the core of who I really am. So it's different than a disease state.
And maybe that's what makes it so much more complex, is because it's really who the person is, and that's a major thing to think about having to heal or overhaul. Or, you know, when someone's depressed, everyone can kind of look and see and say, oh, depression, that's not good. You're not functioning. You're unhappy. But when it's me,
and you're not yourself, right?
Right.
And usually like this, you're not yourself right now.
Right.
I can tell you're depressed. This isn't the real Lisa right now.
And you know you've had other times, and you know you like those other times better, as opposed to when it's your personality. This is me. Well, that's going to answer a bunch of the questions I have for later, but we can start to see why this is so complex.
Right. When someone needs help with a personality disorder, what we're saying is they need help with how they feel about themselves, how they feel about others, how they relate to others, how they interpret others' behavior toward them, how they handle themselves emotionally. It's sort of like, it's everything you think, everything you say, and everything you feel, and everything you do.
Right.
That's what your personality is.
Right. Yeah. Okay. So I have a lot of questions that this is going to be helpful with, but just sort of staying on the track, you know, of breaking it down and what it is and defining it before we get to the next level. Because I like to do these trainings sort of in a very specific order. Can we talk about the subtypes? We've gotten this very clear foundation of what personality is and what it means to have a disturbance in one's personality, and why it might happen.
So yes,
there are different types. A lot of people will maybe have heard the term borderline personality, but there's many different personality disorders.
Yes. So
can we spend a little time talking
do that.
About what those differences and what that is, what that means?
I want to clarify one thing as we do that, which is that one of the mistakes that many people make, and not just lay people in the public, but actually therapists make, that they jump to identify a personality disorder based on the type the person's acting like, rather than starting with that first thing you and I just reviewed. Do they have personality disorder in the first place? There are people in our society who are very shy, or they seem to be very full of themselves and very grandiose or pompous and arrogant, but they don't have narcissistic personality disorder just because they're very full of themselves. You know, there's some people that are very confident and full of themselves, but they're lovely, wonderful people. They're empathic. They function well at home. They function well at work. And sometimes we jump and identify personality disorders, but what we're seeing is a personality. So you've got to start with whether those two or more areas are really compromising their ability to function or feel happy before you call it a disorder. But yes, so the first way to break it up is there's three groups of commonly identified personality disorders. Now there are other types that are not as common and not described as much, but the three clusters, they call them. There's cluster A, cluster B, and cluster C. And so there's a funny mnemonic that people come up with. It's sad, bad, and mad. Actually, the reverse order: mad, bad, and sad.
Right.
The first group of personality disorders in cluster A that people may read about or hear about, there are 3 common ones there, which are schizotypal personality disorder, schizoid personality disorder, and paranoid personality disorder.
Mm-hmm.
So those, actually, I said relatively common. I mean, they're actually kind of rare in the population, but commonly identified as a personality disorder. So schizotypal personality disorder are people, they have the following characteristics. They come across immediately as very odd.
Mm-hmm.
They might speak in a very strange pattern. They might dress in a very strange way. The way they conduct themselves with you emotionally is very strange. They're interested in weird things, like they become involved in fringe organizations and fringe groups. They have sort of odd beliefs about things. They might be into the paranormal. They might be people who wonder if they were abducted by aliens, or wonder if just the kinds of things that, you know, most of us don't take with a lot of seriousness, but they are, you know, interested in alternative strange things.
Got it.
That's, you know, what that personality often looks like.
Mm-hmm.
A second disorder identified in that group is schizoid. Schizoid people are just much more comfortable with solitary activities and being alone. They find it just truly exhausting and overwhelming and unpleasant to have to get involved emotionally with other people. They often don't engage in any kind of love, romantic, or sexual relationships. In a community where marriages are often arranged, these can be very unhappy marriages with people like this, because they really don't feel or get close to other people in a lot of ways.
Mm-hmm.
And they're more comfortable being alone, and they might not understand the need for closeness or close companionship. They may not understand that.
Right.
And they're really sort of almost like they're missing a piece of what most of us feel very passionate about. And they don't look like they have a lot of passion about things.
Right. And it could probably be, well, we'll get to what it's like to be in a relationship with somebody, but obviously can be very confusing, like, because it's so, if they're not acting overtly weird, but they're just not interested, I could see where a lot of people would do a lot of self-blaming and then get confused, and, you know, I don't understand why I'm not good enough. And
that's
so
exactly
it's hard to understand what it's like to be in a relationship with somebody like that.
When we talk about what it's like to be in a relationship with someone like that, we'll be talking about what is like the normal person's response, who's not, you know, studied psychology for years and years and knows how to diagnose a disorder. They're just trying to meet their neighbor or meet their friend or date someone in the shidduch process or relate to another person.
Mm-hmm.
How am I going to react when someone is treating me in such a weird way that I don't understand, or someone is treating me, that's how we'll think of all these. What would like an ordinary person, how would they feel about a relationship with this person?
Mm-hmm.
So the third group, paranoid personality disorder, within cluster A, these are people who characteristically attribute hostile intentions to other people. They might sometimes believe in conspiracy theories, and sometimes, you know, believe lots of bad things are happening. Actually, the schizotypal group might believe in a lot of conspiracy theories as well. But it's also just, you know, when I go into a restaurant, I feel like the restaurant is overcharging me. If the waiter is very, very friendly, I feel like he just wants to get me to give him a big tip. When I go to buy a car, I feel like I'm getting cheated. I feel like they're lying to me about the car. You know, it's just always kind of assuming that other people are trying to hurt me, trying to cheat me, and kind of this built-in assumption the rest of the world wants to do something bad to me. And which is like a very unhappy, sad way to go through life.
Right. And you could really hear the distortion or the disorder in cognition.
Yes.
That, you know, thinking everybody has a negative ulterior motive. It's not that all of us don't sometimes get suspicious of like things like that, but this is more consistent. They consistently attribute negative conspiracy theory type of ideas to what, or motives to what people are doing or saying, or you know, to that, you know, in relation to them. So it's a disturbance, it sounds like, both in cognition and then in relation.
Yes, and now here's a chance to talk about one other feature of it, which is the rigidity of the traits. So let's say that you were a rabbi or rabbinical judge. When you're in the process of, you know, hearing a din Torah, the Mishnah says you have to look at the litigant standing before you like they're wicked people. You have to be very suspicious. They might be deceiving you. They might be lying. They're trying to avoid paying damages, and you have to be very, very suspicious. Like that's now. Then when they leave, you have to look at them as though they're righteous if they've accepted your verdict. When you go home, hopefully, you're not looking at your children as though they're trying to cheat you. You're not looking at your wife. Like, you have to be able to be suspicious where it's adaptive to be
appropriate.
You know, when you're a doctor, when you work in the emergency room or in the prison system, you have to be very suspicious. But when you're in another setting, you shouldn't be very suspicious. So paranoid people are always in that mode. They're always in the mode of detecting someone cheating them. And they feel that they really know. Like, they're the ones that know exactly what's really happening, and the rest of the world are kind of suckers. So it's a very hard disorder to get through to, because they think, oh, you're naive. You know, you're trying to get, you know, or why do you want me to not realize this before?
Right. Wow. Okay, that's very clear. Thank you. So that's cluster A.
Right. So cluster B, we'll move on to cluster B. And this is the disorder that's the group of disorders that is called dramatic and erratic. So this includes, we'll start with narcissistic personality disorder. Narcissistic personalities are people who have trouble regulating their self-esteem. And they do so, according to the DSM definition of narcissistic personality, by sort of building themselves up, covering themselves with kind of narcissistic armor. I have to always feel awesome. I have to always feel smart. I have to always feel attractive. I have to always feel superior. So I spend a lot of my energy on trying to reassure myself that I'm a capable, smart, popular, important, significant, hush-of person. And that's what a lot of my energy is devoted to. And I similarly devote a lot of energy to not feeling inferior, not feeling unimportant. And I can't really tolerate if people don't treat me in the way that I need them to treat me. So that's what narcissistic people look like. They tend to be haughty, grandiose, and, you know, in a Baal Gaiva, that's a rabbinic term for identifying a narcissistic personality. A Baal Gaiva is a narcissist in that way.
Got it.
A haughty, arrogant person. Another disorder, which is actually similar in some ways, but a lot more pleasant for us to be around, is histrionic personality, the histrionic personality disorder. These are people who need to feel reassured, but they want to be reassured by feeling loved and feeling a lot of affection. And they are very fun, actually. That's how they first come across. They're very fun, they're very flirtatious, they make lots of friendships. But as we get to know them, we see that those friendships are rather superficial. They're always looking for something new in a relationship. And they might be very sensitive to rejection, very sensitive to being let down. But they like to be the life of the party. They like to tell jokes and make people laugh. They like to get lots of affection. They like to look nice. They like to socialize. They love romance and falling in love. They can be very fickle in love. But that's what that personality resembles. Another disorder in that cluster is the borderline personality disorder. So the borderline personality disorder is one of the hardest ones to understand because a lot of the things they do seem so senseless to us. But if we think about it, it's easier to understand why they would do these things. People who are borderline are coping with a fear of being alone and abandoned. So a lot of their energy is devoted to making sure no one leaves them or abandons them. And they might do very dramatic things to stop someone from abandoning them. So people can't tolerate breakups. They are afraid their friends are rejecting them. If I call you and you don't get back to me, or I email you and you don't get back to me, I send you a text and a lot of time goes by before I get another text back, we all can relate to the feeling, gee, am I being ignored right now? We all have that little bit of a gnawing suspicion. At least I do. I don't know if you are that secure that you don't, Lisa.
Depends how badly I want the person to get back to me.
Okay. So in
it's
a very...
how I relate in my personality versus how...
Right. So that's a good one. I would like to learn that one from you. So when people with borderline personality are constantly coping in a very dramatic way with feeling shut out, rejected, abandoned, and alone, and they can't tolerate feeling alone. They fall apart or fragment when they're alone. So they feel chronically empty and lonely, as you would think. They manipulate people or plead with people to constantly reassure them so they never feel alone. They can be clingy. They can feel like a leech emotionally in some ways. And they can become very frantic and desperate. They can be suicidal. They can even harm themselves. And they have trouble just soothing their anxiety and their tendency to anger. They have very powerful, anxious and angry emotions. So those are things that they're constantly coping with. And it's a group of people who also have a high rate of eating disorders and a high rate of substance abuse disorders. And it's one of the most challenging groups to work with in psychotherapy because when they bond with a therapist, they turn to the therapist for all that emotional support. So you're nodding your head really dramatically right now, Lisa. What's going on as I say that?
Well, you know, I think that when I think of how hard it is to work with someone with a personality disorder, that's the extra layer that I'm thinking of, because the relationship engulfs you in a way that we'll get to in terms of the special challenges of how it affects the person of personality disorder, how it affects being in a relationship with them, and then also how it helps the helper, how it affects the helper, because they're now in what the person with the personality disorder has created along with the other people in their life, and you're trying to help from within that system, which can be very sticky and tricky and difficult.
Now, with people who are borderline, who have borderline personality disorder, one of the things that is important to keep in mind is they really have to be treated by someone with special training. I don't think people with borderline personality should just be referred to a STOMP therapist. Yeah. There are some of us, for whatever reason, I'm one of these people, I like working with people who are borderline, and I always have a few patients with borderline personality in my practice. However that is, you know, we won't get into that now, but whatever it is about me, I can work with people like that. But I have a lot of training, and I continue to talk to other therapists. Therapists who treat borderline patients are constantly turning to one another for supervision, for consultation, for support. But you have to send someone with borderline personality to someone with special training. Right. Well, and the last thing to add, as a trauma therapist that you are, this is a group of people that often have a history of trauma. Not always, by the way. It's a mistake to always look for trauma in this group, but often there is physical, sexual, and emotional abuse in the past with these people, and that becomes an important part of their recovery. So I think, I'm sure we'll talk about borderline patients further in this interview. The last group in cluster B that I'll mention is the antisocial personality disorder. That's actually a group of people that are put in this category because they sort of fit in superficially, but this is a group that doesn't really fit into the entire overall project of personality disorders. These are people, I'm not even sure it should be called a personality disorder, but we don't know what else to do with it theoretically. And they're a group of people who don't conform to society's norms for moral, ethical, and collaborative behavior. These are people who are breaking the rules, breaking the law, exploit other people, don't seem to have a lot of remorse for what they do, don't really become connected in an authentic way to people. Certainly career criminals and con artists are the classic profile of people who are antisocial.
Right.
And another thing that's interesting is I find that when I meet with people who are going through a high conflict divorce or any kind of other high conflict, the person on the other side of the conflict is immediately diagnosed as antisocial. Like we don't like people, we identify their behavior as antisocial.
Right.
But it'd really be a term used for people that are like constantly exploiting others. The core characteristic is that all of their relationships involve exploitation of another person.
Right. It's not a situational thing. It's not, I'm worried about you abandoning me when you're really talking about breaking up with me. But otherwise, I interact with my other, you know, relationships in a non-threatened, constantly threatened way. It's consistent.
And I want to make sure, I was trying to joke before. In other words, people accuse someone they're mad at of being antisocial, and they're not antisocial.
Right.
Not that people become antisocial when they're going through divorce.
Right.
But how many people under stress might lie or steal or break the law under tremendous stress?
Right.
That's not antisocial personality disorder. I'm not condoning it, but I'm just saying.
Right. That's situational.
Situational moral failure.
Right.
And their only motivation for a connection is in order to exploit someone. That's, you know, and they exploit people financially. They steal their credit cards. They steal their social security numbers. I mean, they're just constantly exploiting other people.
Right.
And they're often, and they're not interested in treatment. And there are not really good, reliable treatments for people who have antisocial personality. There are children with conduct disorder who, that can be a risk for a precursor to antisocial personality. There are interventions for children and adolescents with conduct disorder. But who are antisocial, you know, they're not interested in treatment. They might pretend they're interested in treatment to get out of some kind of legal trouble. And, you know, it's not really something to spend a lot of energy trying to help. Because it's trying to help others not be exploited by them.
Right. Got it. Okay.
So on to cluster C. So cluster C are people who are anxious and nervous. It includes avoidant personality disorder. Avoidant personality disorder is what we were talking about before. People who are pathologically shy. They're afraid of being scrutinized or criticized or rejected. And therefore, they really don't engage in any kind of like, well, they're very, I shouldn't say don't engage in any, but they're very reluctant and limited in how much they can make friends, flirt, put themselves out there, meet people. And they're shy and have limited relationships in their lives. Unlike people who are schizoid, they're not more comfortable with being alone. They're actually very lonely, and they're very unhappy about the fact that they're lonely, but they just really find it so stressful and distressing to take the risks it takes to socialize. So that's what the challenge is for these people. They actually can be very rewarding people to work with, because the therapy process itself is already a social encounter.
Right.
Therapy that can be enormously helped. Another group is the dependent personality disorder. These are people who really need to have others run their lives and make decisions in their lives. And they're afraid of doing things on their own, making decisions, taking responsibility, and they tend to find themselves in relationships with other people who will kind of take over their lives and assert things on their behalf. That's a disorder that can be very masked, because in certain relationships, lots of couples just have ways of fulfilling one another's deficits. That's how a lot of couples work together, like halves become a whole. So a lot of dependent people are in a relationship with someone that's sort of taking things over for them. And a lot of dependent people become very dependent on authority figures. So I'm imagining that there will be Rabbanim and Rebbitzins and college teachers that are watching this, and they're going to be nodding their heads. Yes, I know people like this. They become very attached to them and want their input in every decision, afraid to think for themselves.
Right.
Then the third disorder in this cluster is obsessive compulsive personality disorder. So this is a group of people who are struggling with discomfort over emotion and feelings and spontaneity. And what they tend to do is organize themselves to avoid unpredictability and avoid lots of emotion. These are people that tend to make lots of lists. They tend to regiment themselves according to lots of rules. The stereotype is these people find it very easy to be accountants or librarians. They might have trouble spending money. They can be stingy or miserly. They might have trouble throwing things away, and they may be hoarding. But what they're coping with is discomfort over emotion and unpredictability and passion. That's one of the challenging things, is some of these individuals have a lot of trouble feeling passion and kind of emotional passion and energy and excitement.
And so there's a vast array, and we're going to try and generalize. Otherwise, this will be a whole course in and of itself instead of a webinar when we get to.
And those are not all the personality disorders. There are lots of other ones that are not written about in books and not talked about in the population.
Right, and there's ones that, you know, I can think of where you can really see features of multiple facets of this, that it wouldn't be so clear cut that you would only name it borderline or only name it narcissistic personality disorder. You kind of get the feeling of both. So there's a lot that's not, that we're not quite completely defining here. It would just be too much, but we're starting to get an idea, and hopefully we'll also start to get an idea of what it's like for that person, although we have to understand that that person with a personality disorder means a lot of different things, but we're going to try and generalize it. Before we get to that piece, though, can we talk about, are there differences between genders in how a personality disorder will show up, or is there a difference in genders in terms of which personality disorder is more common in men or women, or are there not those kinds of differences? What's your understanding of how gender plays a role in those two areas?
So there are a lot of different views on that question. What we can say very clearly is that there are differences among the genders, the way personality disorders are being diagnosed. That's for sure. For example, it is much more likely for women to be diagnosed with borderline personality than men, and it is much more likely for men to be diagnosed with antisocial personality than women. Now, you know, that may mean that women are more likely to suffer from this personality syndrome, and men are more likely to show antisocial personality than women. It also may mean that people making the diagnosis are biased to see it that way. It may mean a combination of both. I think that there's a growing recognition that borderline personality in men is probably as common or nearly as common as it is in women, and it's been unrecognized. It's been seen as narcissistic or seen as seen as antisocial. The other thing is that in certain communities socially, there are real gender differences in what the expectations are. So if you're in a very traditional community where the man is expected to be the breadwinner and the woman is expected to be at home, then there are differences in independence and dependency. There are differences in attachment and in relationships. So there are social factors that go along with gender, and it's very hard to sort out what's innate in the gender and what's just because of the roles that we're put into in society. But yes, there are some gender differences, and knowing how to understand that is a complex thing. Right.
Are there sometimes gender differences in the sense that, you know, if a man has borderline personality disorder, he'll tend to get more aggressive when he gets aggressive, you know, in relation to feeling threatened than a woman will. So we jump to that antisocial diagnosis versus the borderline. Like when someone would diagnose a man, is he going to look different, or he's going to really basically look the same if you are being consistent in your criteria?
To me, as a clinician, it looks sort of the same. But I do think, you know, there are social and gender differences in aggression. So I think that's a good example. That might be why a lot of men with borderline personality have been identified as antisocial. Supposedly, I mean, I read a study that the prison population has an 80% incidence of borderline personality. I don't know if everyone agrees with that, but you know, there is a lot. whether if someone is borderline and they're constantly being triggered and they're in, you know, a social environment that there's lots of conflict, then that person might get arrested a lot and might break the law a lot and might look antisocial. It's really as you sort of get to know someone that the underlying, you know, personality really comes into clarity.
Right.
So is it,
yeah.
You go ahead.
There's also different degrees of severity that people talk about when they talk about personality disorders. I don't know if that's true of all the personality disorders have varying degrees or...
Yes, that's definitely true of all of them. All of them can be more or less severe. You know, how different than most of the population in each trait, and how rigid is each trait.
And so...
Too, like, let's say someone has a really high intelligence and a really supportive family and, you know, is blessed with a pretty good temperament. They can cope with their personality, you know, vulnerabilities a lot better than someone who also has depression and also has a really unsupportive family and also has lots of other social problems. So environmental things can also just, you know, some people are spared a lot of trouble because of having very supportive families, having a lot of money to get good treatment, having gotten a good education. So some of the disorders, just depending on the circumstances, cause less distress and are less apparent.
Right. So that'll be the severity and functioning as well. You're talking about the severity of how it shows up based on their family, but are we also talking about the severity of, I guess that relates to the severity of their functioning with...
How much does it interfere? How much does it interfere with their lives?
Right.
You know, and so people, you know, in the most severe forms, personality disorders can really impair people from living functional lives at all, from being able to work, from being able to get married, from being able to be happy, to have friendships. I mean, that would be in the most severe cases. People with some disorders where it's very severe, it's just as severe as other major mental illness.
Right. So it holds them back from regular functioning.
Right.
And are there those that are kind of aware of that and disheartened, and those who are, you know, if no one would ever say anything to them, they would be perfectly comfortable in that skin because it is their personality?
Well, I think you're talking about insight, the degree of insight people have into their personality difficulties. I think most of us don't like to think of our personalities as having lots of rough spots and weaknesses. So it's like a universal human thing that people are not just like totally open about knowing all of their faults. In fact, if someone says, I know all my faults. Right. So if someone's saying, it's hard for me to recognize my faults, that sounds like a more insightful start with. But yeah, there are different degrees of insight. And some people with, you know, really kind of very severe personality types don't seem to want to change. Not all these people do want to change. The motivation to change would be when they're in pain over something, most likely.
Well, for any of us, the motivation to change is when we're in pain over something. But if it's your personality that you're kind of saying, I don't like being around people, or I believe that everybody really does have it out for me, or I do think that this weird, you know, alien thing is true, and, you know, all of those kinds of things should be in order and things should have their place. I think that insight's probably one of the hardest hurdles to getting somebody to treatment.
It is. I think that's exactly right. And often people are sent to treatment. People with personality difficulties are sent to treatment by their significant others, by their children, by their parents, by their bosses, by their professors, by their rebellion, by their Rebbitzins.
But and still can be difficult, because even if they're sent and agreed kind of to go, there's still the personality that turns everything outwards. No, it's your fault, or you're really after me, or you're really the problem, or it's it's a huge hurdle. And we'll get to that as well. I wanted to, going back to talking about how it affects their life, and you talked about how it can affect their functioning or their ability to actually have these relationships and do all the normal things that people, especially in our community, expect to do, have family and have relationship and have community and have children and have health. How would you say it interferes with their religious life?
Well, that's a really interesting question. That's a really interesting question. So let's think for a second about all the things you have to do to participate fully in religious life in a Jewish community and in a Jewish family. Mm-hmm. So for men, one of the first things we think of is Torah study. So you have to be able to, humble yourself, to accept that there's this huge sea of knowledge and I barely have one little drop of it, and it's going to take me many, many years in order to even make a significant dent in this huge body of knowledge. So that's something that someone has to be able to, cope with in the first place. And there are people with narcissistic problems that have trouble letting themselves acknowledge that, they don't know something. That would be the challenge for someone with narcissistic problems. Someone with obsessive compulsive problems can find it really difficult to focus on a big concept or on a large theme. They might be really good at learning nitty-gritty little halachot and rules, but they would have trouble sort of taking in a big picture. They have trouble with uncertainty. They need to know the answer right away. If you look at people, like the Mishnah says, ein habaishan lamed, that someone who's excessively shy can't learn. That's because they're afraid to ask questions, they're afraid to speak up, they're afraid to say when they don't know something. So people with avoidant personality will have trouble as students. People who are too authoritarian or too arrogant will have trouble teaching, and the Mishnah says that also. Ein hakaftan melamed. So, the 2,000 years ago, the sages were already asking that question, like, how do people's personality problems interfere with their religious life? That's just in learning. If we think of relationships in religious life, like, you have to be able to be part of a community. You have to fit into the community. I think that living in a tightly involved religious community where we're very enmeshed with one another, it requires lots of personality flexibility. There's not a lot of privacy. People notice one another all the time. People are trying to set one another up with shidduchim. They're wondering why someone isn't married yet. They're wondering if someone loses a job, everyone knows they lost a job. We don't have lots of privacy in our we live in a fishbowl. So if you're afraid of being scrutinized or afraid of being criticized, or you need to always look perfect or always look wonderful, it's very stressful in life. If you think of all of the things that we have to just juggle at the same time, it's a very, very busy life. I mean, how many people are working 2 jobs, might both be full-time or at least 1.5 time, and then trying to keep a seder, trying to get ready for holidays, trying to daven? How many wives are raising multiple children, trying to also work, trying to make lots of meals, trying to do chesed, having guests in their houses? I think that it's a very overwhelmed life for a lot of people. So people find it stressful to, whatever your personality challenges are, it's going to make all of it that much more stressful. So, we're very blessed to have very rich, involved, connected lives with one another. But for people with personality challenges, it's really difficult. The more flexible and adaptive your personality is, the better a Jew you can be in a lot of ways. It's not just your intention. It's like it sort of comes more naturally to you. You can roll with the punches. You can tolerate people asking you questions all the time and intruding into your home to say hello and wanting to know about your children and you. And, it's just easier to cope with all that depending on their personality.
Right. And so it really, hampers the person with the personality disorder is set apart and therefore not as connected, not only with others, but with God, is really what I hear you saying. It's hard to feel connected to God when you're in defense mode, because there's so much else going on and your personality structure can't really handle it.
Well, that's another really important, it's interesting, but it's also just very important as religious Jews, areas of religious life that you brought up that's really central. I was focusing for a second on the social things. So if we think of someone who has, you know, who always feels criticized by others and always feels scrutinized and always feels like people are mad at them and is always worried about not measuring up and not, those people, interestingly, we find in our therapy with these people tend to feel the same way about Hashem. They really feel judged by God. They feel judged has little tolerance for them. They feel they feel God is frustrated with them, mad at them, has no compassion for them. They kind of attribute the same sort of harsh, you know, ways of relating to God, the same way they think about other people in their lives, and interference with their ability to have a relationship with God. Conversely, people who are so haughty and arrogant and can't ever see any flaws in themselves, they would have the same distortions in the way they relate to Hashem. And so it's, you know, God is a relationship.
Right.
So,
and they don't have any better relationship with God than they are having with the other people around them, basically.
well, you know, the same ways they are in relating to others, you know, those patterns show up in the way they think about and feel about God.
Right.
So it really affects every dimension of religious life.
So it's basically about relationships, because our avodas Hashem is a relationship with Hashem, and they're relating the same way to other people that they're relating to Hashem, and it's disordered, it's distorted, it's disordered, it's a real challenge. Now, we said that people who suffer with a personality disorder really don't have a lot of insight into that fact. And
Often, I mean, they can develop it in the course of therapy, and some people just do. There are some just naturally insightful people, but yeah, I think with personality disorders, most commonly not.
Right. And so before they get to therapy, how might somebody, because, you know, this segment that we're doing now is really, we want to talk about the person themselves, what it's like for them, what goes on, what it is. And if somebody happens to be watching this and starts to say, right, what questions could they ask themselves that would maybe gain them enough insight to get to therapy? Right? Because yes, they can grow some more insight in therapy. How are we getting them to therapy?
Well, I think that if someone feels that life is not going the way he or she wants it to, I don't have friendships in my life that I wish I did. I've lost a lot of relationships. I've lost a lot of friendships. The relationships I have are not very satisfying. I have trouble at interviews. I have trouble getting a job. I have trouble holding a job. I've lost lots of work. I'm constantly getting in arguments with people. I mean, these are various kinds of things that people may have. Or I'm constantly told that I'm overreacting or reading into things. You know, I'm all my relatives and my friends are always telling me, you know, you always assume the worst about people. You always are. If I'm getting feedback from people and from the world that, you know, the reason things are not going the way I want to is because I'm just routinely mishandling things. I don't want to. I'm trying as hard as I can, but it's not going the way I want to. Then I would recommend contacting a therapist for a consultation. And you don't have to worry about diagnosing yourself, you know. But things are not going well, just think of it as like, is there someone that could help me figure out why it's not going well?
Right.
And could we come up with better strategies that would be more successful for me? And it doesn't matter really what the diagnosis is, if that would be the case. So I would sort of encourage people to not worry about the diagnosis. Right.
But if they're unhappy, and, you know, I think what stops a lot of people is, yes, they're unhappy and they have all these things going on, but often in the world of the person who has a personality disorder, that's because of that one, you know, that boss that, and that friend that, and that other friend the other thing, and it's all outside of them. So why do I go to therapy? Therapy isn't going to change those guys. And what, you know, somebody, whatever the diagnosis, might want to think about is that if all of this is going on for you, and even if you're convinced that it's nothing you're doing, you still want to have someone help you figure out how to have more satisfying relationships, job or marriage or friendship, or how to have, even if it's everybody else's fault, how to have more satisfying relationships and a more satisfying life. And that can happen in the therapy process.
Right. Well, look, there are certain people that really don't want to go to therapy, and the only reason they go is they're kind of given an ultimatum. And then it's really up to the therapist to talk to them, and if they find the conversation helpful, they might want to come back. So I think it's this is someone who might be helpful to you. Not to worry about the diagnosis, not to worry about what the treatment's exactly going to look like. Is talking to this person helpful? And so I think it's a matter of saying to someone, listen, things are not going well for you. You've been unhappy a long, long time. You've got all these things that have not worked out the way you want, despite the fact that you have so many talents, so many abilities. It just seems like things should be going better for you. Would you think of a consultation with someone that might be, it might be helpful to talk to them?
Right.
And so, yeah, but that's what we're always dealing with in therapy, is that people would be reluctant or resistant to the idea of getting help because it feels like blaming in a way.
Mm-hmm. Right.
So I just think that's part of our professional challenge as therapists.
And again, why it's so important to go to somebody who's had this kind of specialized training. And if by some chance the person in the clergy position does detect it, to make the first shot be a therapist who has the specialized training, because you are going to be encountering somebody who is resistant in this way, and engaging them in a process that can be focused on them and therefore actually helpful is a real skill that needs to be learned. And I think that answer, what you were saying just now really answered my next question. We started out talking about how could someone maybe gain enough insight if they happen to be watching this, how could they gain enough insight to get themselves to therapy? But then we sort of morphed into what you could say to them what I thought I heard, what you could say to them from that helper position. Here you are, the Rebbitzin, here you are, the college teacher. Here's some person talking about how they're miserable, and then their job history and their relationship history, their friendship history, their family history, but it's everybody else. What you just said before is really also what the helper can say to them. You're so unhappy, and there's been so much, and maybe there's something that, you go for a consultation and you can really hear out how a therapist might be able to help you have relationships in the world. That's because my question was going to be, after we talk about the person identifying it possibly themselves, is if we identify, how can we?
So one of my teachers said to me something really helpful, Dr. Jacob Lindy. He said there are basically two reasons that people come in for treatment. The first reason is, I'm in pain and I want to be in less pain. And that's symptom relief from symptoms. But, I'm in pain, I want to feel less pain. The second reason people come into treatment is, I just feel that I should be further along in my development or in my abilities in relationships or in the way I'm able to think about, like, I don't think I'm doing as well as I ought to be. I feel like I'm behind. I feel like I'm stuck. If I look at how I'm handling my life and important things in my life, I feel like I could be handling it better than I have been. And that's different than, so I think what you're wondering is, how can you persuade someone who isn't in a lot of pain that they're aware of to recognize that things could be better? And I don't think you can really do that. I don't think you really can. If someone feels like they could be handling things better than they are, and then things would be going better for them. That's a pretty insightful person. I think that's,
Right.
and that's actually a very good prognosis for therapy. When people come in like
Yeah.
that, I can almost guarantee the therapy is going to go very, very well.
Yeah.
But the more common indication for therapy, or not indication, the motivation for therapy, is people are feeling a lot of pain and they want to come in. And in terms of the personality disorders, some of the disorders are associated with lots of distress, like avoidant personality, borderline personality, histrionic personality, at times narcissistic personality. Those personality disorders, people feel lots of anxiety, lots of sadness, lots of depression, lots of heartbreak, lots of loneliness, and they want help with it. They want help feeling better. There are some of the other personality disorders, people really don't recognize that something is wrong. It's like unlikely, I would say, that they will want to come for help. And I think the best that can be done is, look, I advise you give talking to this person a try. But I think it's, hard to persuade someone of that. What it really is I think you have to give them a sample of therapy. And if a conversation, 2 conversations, 3 conversations is really helpful, then people will want to come back and talk more with you.
Right.
Because it's helpful.
And when somebody, let's say in the Rebbitzin or college teacher position, really feels like this is what they need, this is what the person needs, the person needs therapy, they're just not going to get better from continuing to come to me, the Rebbitzin, and tell me everything that they're upset about, and the person is resistant. Do you recommend setting a boundary? Do you recommend, kind of holding a line of you need to, or I can't because this is not like, do you have a recommendation like that when it comes to, personality disorder?
Let me give a few scenarios because I think it's different in every case. So one of the reasons I love referrals from Rebbitzins and Mechanchim and Rabbanim is that they have certain things that they do to help people very, very well. And they've worked with lots and lots of people. And when someone isn't responding to what usually helps other people, they can be very skillful at, making a diagnosis, or they might not know exactly what the diagnosis is. It's one of a few things, but there's something wrong here. And they know. It's like if you're a teacher and you've given the same lesson plan, the same program to 1,000 students, and 4 of them won't respond to anything, but the other 996 will, there's a problem with these 4 students. You're doing the same thing with everyone else. So I love those referrals because they have such like a professional experience. They really know how to identify problems in that way. What happens is, they try to do rabbinic counseling or pastoral counseling, and pastoral counseling can be somewhat helpful. When it's not helpful, when the things that usually are helpful to other people are not helping this person, then they realize, okay, there is something more deeply wrong here. There is a problem that is more severe that interferes with their ability to take good advice from me. You have to have a certain degree of health to take good advice. It's not that the therapist is going to give good advice. The Rav is giving very good advice, and the person can't take their advice or won't take their advice or tries to take their advice and doesn't understand their advice. So in terms of drawing a boundary, I think that the boundaries that should be drawn would be that Rabbanim, Rebbitzins, Mechanchim, they should not feel pressure to manage a problem that is beyond what they're trained to do and beyond what they feel comfortable doing. So when your gut is that, oh my gosh, like I'm afraid that if I don't continue to be available for this person, the person could be suicidal, or the person is going to go off the derech, or the person is going to do some dramatic thing, or this marriage is going to fall apart if I don't call him or her every single day and reassure him or her. If that's the kind of situation you're in, I think that you need a professional referral, and you have to say, listen, I really would do whatever I can to help you. I honestly would, and I have. but it isn't helping anyway. So I'm not giving up on you. I'm not abandoning you, but I just don't have the tools to help you.
Mm.
You know? That's kind of how I see it. And a lot of Rabbanim, I think, feel stuck. They feel that they're going to be rejecting someone by passing them off on a therapist, and the person is going to feel. But you know, a lot of Rabbanim and Mechanchim and Rebbitzins go way beyond the call of duty to try to help people, and they've lived their families. I mean, the boundaries are very different for a Rav or a Rebbe.
Right.
You
Right.
have to stay in your home. You set people up. You borrow money to help people. I mean, it's a very different boundary. It's more like a relative.
Right.
A lot of times, and they've gone way beyond what can be reasonably expected because that's how giving and devoted they are. And
Right.
so, well, you can say, listen, I've really done what I can, and I would do whatever I can, but I don't have another tool in my box. I don't have another play or another card to play for you.
Right. Well, I think that's really key language that you used. I would do whatever I can, and I have, and you're not further than you were. So if I've done everything I can and it hasn't helped you enough, I think that's an indication. I'm not abandoning you.
No.
I've done everything I can, and I want more for you.
Right. I'll continue to be your Rav. I'll continue to meet with you. I'll continue to learn with you. I'll keep giving you advice. But the advice I give isn't helping you anymore.
Right.
Helped you a little, but it's not solving these problems. And like, you're really unhappy, and now you're getting mad at me because I haven't solved this problem for you. And I think there's enormous pressure on some Rabbanim that they really feel that they have to be able to solve every problem. I think they really do want the best for their congregants or their Talmidim, or their Kehillah members or their Hasidim. They really want the best for them, and they feel responsible. I mean, that's really what it is to be a Rav. It's to be responsible for another person's welfare.
Right.
So it can sometimes feel like a failure, like, well, I'm not good enough of a Rav, or I'm not good enough of a Rebbitzin, that I'm not able to help this person or persuade them. But people with personality disorders can't benefit from your excellent advice. That's the problem. You know?
Or any mental health. If it's a true mental health issue,
right?
It's you know, the topical stuff, and like you said, they've seen 1,000 people, and their general chizuk and wisdom will benefit 996. And when those 4 are just intractable, whether it's depression, whether it's anxiety, whether it's personality disorder, when there's those 4 where it's intractable, it hasn't moved, what they usually do hasn't moved, we've risen beyond the general human condition and into a mental health area where you need a healing, and therefore you need somebody who's trained to engage in the healing process. And that's different than in the counseling process.
And one of the things that's also important to understand is that there are a lot of things that Rabbanim, Rebbitzins, Mechanchim can do much better than a therapist can do. There are a lot of things that we can't offer, won't offer, hopefully. I mean, there are therapists that want to be a rabbi, you know, and they really shouldn't be, because we can't do it well. If we try to, we're going to ruin the therapy in some way.
Exactly.
We can't do it. So it's not that it's like, you know, the congregant-rabbi relationship is over with, or the Rebbe-Talmid relationship ends. No, it's that the therapy can help that relationship succeed more.
Right.
So we have to send people back able to do better.
Right. And I think that, you know, if the Rebbitzin or the college teacher or the Rav finds themselves in this place and they're struggling with the person or getting the person to help, I think that they could also think for themselves of making a phone call. Most of us in the community are happy to interface with the leadership of our community because we see how vital their role is. And, you know, and because there's so many differences between this person who's depressed and this person who's depressed and this person who's depressed, or this person and their personality disorder and this person, that it might be a benefit if that person is struggling, if that clergy person is struggling getting somebody to engage in treatment, it might be a benefit to call the therapist and say, let me tell you the specifics of this situation and this person and what they're struggling with. Maybe you'll help me even further than this general webinar in a language or an approach or a script for how to get this person to the place they need to be, meaning treatment. So, you know,
I think most of us get calls from communal religious leaders like that. You know, I think we get calls like that all the time.
And could we talk for a minute before, you know, we sort of close this part one, about what does treatment look like? What are we talking about when we're talking about they're going to go for treatment or they need treatment? What are we talking about when we talk about treatment? What does it look like?
Well, when we talk about psychotherapy treatment, what it looks like superficially would be two people in a room talking. That's what it looks like.
Right.
What it involves is there are different types of therapy, but what they all involve is essentially that someone with an emotional difficulty is coming for a consultation with someone who is listening and tries to offer a different way of thinking about or experiencing or handling difficult problems. Depending on the problem, it could be that I'm going to advise behavioral therapy. I'm going to tell the person, listen, I want you, let's say someone who's very, very shy. What I'm going to do is we're going to try to find ways that you can interact with other people that are not too nerve-wracking for you to handle. It might be online. It might be, you know, through some kind of online form. It might be with a bunch of people you know already. It might be with people who know you're shy. It might be that I'm going to tell you to find friends that know you're shy, and you're going to say, I am trying to overcome my shyness so I can have more of a social life and have more friends, and I want your help with it. And this is what I want you to help me do it. There could be lots of actual tasks where that's behavioral. Behavioral therapy is usually assigning people sort of progressively more and more difficult tasks to expose them in a sensitized, graduated, planned way to the thing that causes them difficulty. And it's, you know, a gradual behavioral program. Then there is cognitive therapy. Cognitive therapy is talking to people about those sort of assumptions they make or the ways they misperceive things, you know. So someone who's very shy might say, I'm not going to introduce myself to her because she's way too busy for me and she'd never want to talk to me and she probably finds me boring. So that's a lot of assumptions, you know. Is she too busy for everybody or she's only too busy for you? You know, why won't she find you interesting? Has really no one ever found you interesting? You know, there are lots of like incorrect thoughts that people have. And there are therapies that are more about people's emotions that they're unaware of. We call that psychodynamic psychotherapy. And psychodynamic psychotherapy is about helping people understand the way they're trying to avoid feeling things that are very distressing. And so what they're doing is they're engaging in lots of like kind of automatic avoidance behaviors. And we try to make them more aware of, you know, the things they're doing that they're not really realizing that they're doing it. For example, there are people who just won't ever let themselves realize that they like someone and wish they were friends with them because they're so afraid of rejection. They won't even let themselves know that they're interested in that person. So if we see that that's the problem going on, we try to help them become more aware of these things that they won't let themselves think about or wonder about. That's a brief summary of, you know, and there are other modalities of therapy as well. Those are three of the most common forms of therapy people do. But the therapist, the way they work most effectively, the way they think that this person would respond the best, they make decisions about what kind of therapy to provide based on their training and based on the problems the person has.
Right. Wow. So this has been an amazing overview for us about what personality disorders are and the different types and how we can understand it and what's going on and all of the basic information that we want to have and know in this helping position. And I really, really, really appreciate your time, Nachum, Dr. Klafter. I really think that the community is going to benefit, because our listener watchership is going to benefit the Rebbitzins and the college teachers. So I really thank you very much. And I'm looking forward to part 2, where we're going to discuss the effect, what it's like for the person who's in the relationship with this person and the person who's trying to help them. So I look forward to that, and I really want to thank you for your time doing this so much. Thank you.